Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. I'm here with my good friend, co-host, and producer, Brandon Como. Brandon, how's it going this morning?
Doing well, Doc. What's going on with you?
Oh, man, I'm excited to be here. You know, I really appreciate each one of our listeners tuning into the show every Saturday morning to learn the latest technologies in natural health care. And, I work really hard to bring some of the latest advancements that you can make to your health every single week on the show, and that's something that I really appreciate everybody taking their time to tune in to try to do something to make themselves healthier. And I want to encourage everyone to start now improving your health. One of the biggest problems that I see in practice is that by the time the person comes in to get looked at, they've put it off for years, and it's way worse than it would have been had they have just taken action earlier. And, if I could change one thing about the health of America, that would probably be what it was. Just take more action, do something to try to improve your health, and don't put it off until it turns into an uncorrectable, chronic, life debilitating disease. But that happens so often. There's something I talk about frequently called the tale of two paths. And so we have two ladies that are good friends that are both 65 years old. One lady is 65 and having the time of her life. She's gardening and shopping with her friends and going to ball games for the grandkids, exercising, and just really able to enjoy her golden years and do whatever she wants. And the other lady may be 65 and is forced to use a walker or a quad cane just to walk to the kitchen, or maybe unable to walk to the driveway to get her mail, or worse, maybe she's in a nursing facility, unable to care for herself, or even worse than that, no longer with us. Now, they're both 65. They're both the same age, and that's very young by today's standards, by the way. But these two ladies are experiencing a very different existence. At some point, their health took a very different fork in the road. One fork led to a life of enjoyment, able to do whatever she wants to do whenever she wants. And the other fork led to loss of mobility, loss of health, and loss of almost everything enjoyable in her life. And now here's the thing to remember about this story. That fork in the health pathway didn't happen at 65. It didn't even happen at 60 or even 55. Years, if not decades earlier, one lady decided to do something that the other one didn't. And so let me ask you, what fork are you on in that health pathway? And so many times we just don't think about that because we're too busy. We want to take our health and kind of put it behind our back so that we can't see it. Don't do that to yourself. Your health is the most important thing that you have. So where is your health going to be in the next 5, 10, or 15 years? And then what can we do to make sure that you're on that right pathway, on that road, so that you can do whatever you want for as long as possible? And guys, that's what this show is all about. How do we get you on that right pathway without blaming it on something outside of your body? People have a tendency to blame their health problem on that thing over there. It's that pollen over there. It's that genetics that I have. It's that age that I am. Instead of kind of turning and looking at the inside and saying, I have something malfunctioning inside of me. If it were pollen, I can go around pollen and my sinuses don't flare up. So it's not that. It's something inside there malfunctioning, causing the problem. Brandon, when I speak to groups all over the country on natural health care, I talk a lot about a lady named Harriet Thompson. Mm-hmm. Harriet Thompson just finished the San Diego Marathon in 7 hours and 7 minutes, and she's 92 years old.
Wow.
And so most people aren't driving at 92. I mean, most people aren't alive at 92, but I would be willing to bet that Harriet Thompson did things in her 40s, 50s, and 60s that put her on a pathway so that she could be running marathons in her 90s. In fact, her story is she didn't start running until she was in her 50s. But in her 50s, she decided to make a change and decided to take action to improve her health. So we might not want to be running marathons at 92, but if we can at 92 still be enjoying our life and getting around and, shopping for ourselves and taking care of ourselves, of course we would want to do that. But that starts years, if not decades earlier. And I can show you the pathway, but I can't make you walk it. You have to take action so that you can end up on the healthier pathway. And today, we're going to be talking about a big one. Today, we're talking about a disease that is so prevalent in South Louisiana, and it's something that so many people out there have. And the problem is the way they're actually looking at it. And that problem is diabetes and blood sugar and the management of our glucose and our A1C. And so I wanted to talk about how all of that fits into your health pathway today. And, honestly, there are two problems that I have to deal with when I'm dealing with someone with diabetes. And, I almost hate to say it like this, but it's true. The first problem that I deal with is the actual diabetes itself. And we're going to get into all that today about how we can get the body to work better and how diabetes can be, worked on from a natural perspective. But the other issue is harder to deal with, and that is how people in South Louisiana look at diabetes as not a problem that can affect their future. I have patients all the time that say, "Oh, doc, I just have the normal diabetes. Oh, it's not a problem." Or they're kind of like, "Well, I went to my doctor. My blood sugar was a little high, and, he put me on something, but my number's been good lately. I'm healthy." That's sort of the attitude that people have been given about their diabetes. Diabetes is a terrible disorder that will destroy your body from the inside if you let it. It's like termites in your house, destroying your house from inside. Diabetes is the number one cause of blindness. It's the number one cause of kidney dialysis. 1/3 of diabetics end up on kidney dialysis, which, guys, is no fun. It's the number one reason for having your legs amputated. You have a 4 times greater risk of getting dementia and losing your memory. Over half the diabetics develop neuropathy, which is numbness or a lack of sensation in the lower extremities. Many have non-healing wounds on their feet that turn into, gangrene, so they have to amputate their legs. And here's the thing. This is the number one sentence I want you to remember from today. All of these terrible complications happen to people who were, quote unquote, managing their diabetes. So they were going through life going, "Well, my numbers are pretty good. I'm pretty healthy." And some of those can end up with these terrible complications. And that's what kind of gets me so, fired up when it comes to dealing with diabetes is people sort of were told, "Well, my blood sugar's good. I'm fine. Just, keep taking my medicine. I'm good." And it doesn't work that way. People think that as long as their blood sugar is in this little box called normal, that they're okay and they're healthy. And that's false. These complications can happen to people who were, quote unquote, controlling their blood sugar. And what you're going to learn today on the show, and I'm going to go through all the details of diabetes and what it means and what you should know about it and sort of what you need to pay attention to and not. But if you're listening out there and you don't have diabetes, this show is still for you, because in South Louisiana, over 1/3 of you out there listening already have prediabetes and don't even know it. If you're over 65 and listening to this, over half of you out there already have prediabetes and don't know it. Now, so this show is for everyone. Now, right after this next break, I'm going to discuss what diabetes means in the body and what you can do to prevent it if you don't already have it. And if you do already have it, I'm going to tell you the next steps that you should take to make sure that you end up on that pathway that could lead you to a long, healthy life and not the other pathway that we talked about. So if you know anybody that has diabetes or blood sugar problems, text them or call them and tell them to tune into the show. And also, I'm going to be hosting a free community workshop called 4 Secrets to Beating Diabetes, where I'm going to be able to break all of this down and show you. Some of these concepts are hard to explain on the radio because I need my charts and my graphs and be able to show you at a cellular level what's happening in the body. So I do my best here on the air, but we're really going to break all of this down in the workshop. You're going to leave there with the best understanding of what's actually happening inside your body when it comes to blood sugar and weight gain and, the chronic fatigue from prediabetes and all of those blood sugar related issues. And you're going to understand what actually is occurring long term. And that way you can ensure that your diabetes doesn't catch up with you. The workshop's going to be Wednesday night, it's August the 29th. It's on a Wednesday at the Hampton Inn Conference Room right there in Broussard. And if you want to call and register, you can call right now. It's 837-7174, and you're going to get an answering machine. Obviously, it's Saturday morning. We're not at work. And when my staff gets back to the office Monday, they'll give you a call and give you the location and the times and reserve your seat. They'll give you all the details. And make sure that if you do have diabetes and you know someone else that does as well, bring them with you. Let them know about the workshop. This is something that could save their entire future. So I'm going to explain in much more detail when we get back on how diabetes actually affects you at a cellular level. So don't go away. And that number again was 837-7174. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. The topic today is blood sugar, how you can control it, what else you should be concerned about, and how it affects your health. And in the first segment, we were discussing how just managing your blood sugar numbers and doing nothing else is not the road to a long, healthy, functional life. In fact, it's likely the road to much worse problems down the road because many of the terrible complications that happen from diabetes, the amputations, the blindness, the kidney dialysis, and dementia, many of those terrible complications can happen to people that were managing their blood sugar. So the general public feels like as long as your blood sugar numbers are kept in this little box, that's good. You're normal. You're healthy. Everything is fine. Not true. That is not healthy, and it's definitely not fine. But typically, here's what happens. Somebody goes in for a checkup or they go for a visit of some sort and they have their glucose and A1C tested. And if those two numbers are out of what they consider normal range, they'll say, well, you're either diabetic or pre-diabetic, and they'll give you some medicine to bring it down. And then on your next visit, you're told, man, we fixed it. The blood sugar's good. Just keep taking your medicine. You're ready to go. And some patients go on for years with this idea that as long as they're managing their glucose and A1C numbers, that's all they need to do. And here's what happens. People get stuck in this focusing so much of their time on glucose and A1C that's what the whole industry has become. That's even like the drug commercials on television. What's your A1C target, or reach your A1C goal by this medicine or that medicine. There's much more to it than that. Guys, America now takes 50% of all the pharmaceutical drugs on planet Earth. Yet we are less than 4% of the world's population. We spend more on healthcare than anybody else in the world, yet China and Cambodia have a longer life expectancy than we do in the United States of America. So just managing your blood sugar and your A1C is not the whole story. And keep in mind, 1/3 of you out there listening already has prediabetes. That's 35% of the adult population. 50% of the adult population over 65 has prediabetes. And what prediabetes means is that if you don't do something to turn this around, you're going to end up with full-blown diabetes with all of the side effects that come with that. 70% of the people with diabetes develop diabetic neuropathy, which is tingling and burning in the feet. 60% of leg amputations are from diabetes. Leading cause of kidney failure And so you do not want to have to go on dialysis 3 or 4 times a week. That is not a pleasurable existence.
I'm sorry, Doc. I didn't mean to interrupt you.
Okay.
I had a question. Is fibromyalgia related to diabetes in any way?
Well, it can be. Fibromyalgia is it's sort of this vague diagnosis, and I have a protocol that I do for fibromyalgia. Fibromyalgia is kind of this vague diagnosis of chronic pain that moves around the body.
Right.
And, they're kind of similar in the fact that whenever the body loses its health to that extent, then those type of things can happen, the chronic fatigue. And, one of the things we talk a lot about here on the show is this energy deficit, that we've brought up several times, to where people are burning through their energy faster than they can make it.
Right.
They don't have enough of that energy molecule to get healthy, and that's a big thing with fibromyalgia as well. But they're sort of connected in the way that they're both related to a pretty significant loss of health.
It's because I've noticed some people that have complained about fibromyalgia also struggling with diabetes, and I'm just wondering about the connection.
There is a connection, because once you kind of start to lose your health, then you're much more prone to getting things like fibromyalgia. Once you get this unhealthy state of diabetes, all of these difficult conditions have a more likelihood of catching up with you. And, here's really the truth about diabetes, and I'm going to talk more about this at my workshop, but the truth about diabetes is that it's a disease of insulin, not of blood sugar. And that's the big mistake that everyone has made. And Brandon, that's like the whole thing that everybody talks about. Well, what's my blood sugar today? Let me check my blood sugar. Oh, my blood sugar was up. My blood sugar was down. And that's where the whole focus is. And it's not about that. It's a disease of insulin. So the first thing that we want to know is, what are your insulin levels? And not just your blood sugar. Insulin controls blood sugar. Now, why we're not testing for insulin levels in America in the diabetic patient, I will never understand that. Many of you that have diabetes listen to this have never had your insulin levels tested. How would you not want to know in a diabetic patient what their insulin levels are? And here's why that's so important. Insulin's job is to take sugar from your blood and put it in your cells to be used for fuel. So insulin grabs the glucose molecule, which is the sugar from your food, opens the cell wall, and puts the sugar inside the cell to be used for fuel. Now, in diabetes, that process is no longer working correctly. Insulin can't unlock the door. It's like it's lost its key. And so the sugar can't get inside the cell to be used for fuel. So the cells think they're starving. Well, actually, they are starving. So you end up craving more and more sugar, which creates more and more inflammation. And then, Brandon, that leads to things like fibromyalgia. So, it's definitely connected. Now, this is important because if the cells aren't getting enough energy or enough fuel from the sugar that you eat, then you start to get all kinds of other conditions. And you end up craving more and more sugar because the cells aren't getting it, even though it's loaded in your blood. So the problem is the insulin can't put it from in the blood to into the cell to where it belongs to be used for energy. Now, many of these medications for diabetes, all they do are simply whip your pancreas to produce even more insulin. So it's sort of like, if I flood your body with enough insulin, it's just going to rip the door off and put the sugar inside the cell anyway. And the problem with that is that insulin in really high amounts is toxic to the human body. So if your blood sugar numbers look good, but your insulin is 5 or 6 or 7 times normal, that's damaging to your body. But we don't know that because we're not testing insulin. All we're testing is glucose and A1C. So looking at glucose and A1C, it's working great. These are all concepts that I'm going to get into at my workshop called 4 Secrets to Beating Diabetes. Diabetes is no longer a life sentence. And so I'm going to show you the relationship between insulin and A1C and glucose. And we'll talk about leptin. Leptin is the hormone that controls insulin. Insulin is the hormone that controls A1C, and A1C is what tells you about glucose. And so you have to get as far upstream as possible in these chronic diseases if we're ever going to get to an answer. And so it's very important that we track this as far upstream as we can. And that's one of the big secrets that I'm going to be talking about at my workshop on August the 29th. It's free to the public. Anybody is welcome to attend. And so I wanted to invite all of my listeners out there that have diabetes to come and hear about what we're doing with this very damaging condition. Or maybe you don't know you have diabetes. Maybe, let's just say you feel ran down or tired all the time, or maybe if you don't eat, you get a little woozy or a little bit dizzy, or maybe you're having difficulty losing weight or you're low energy. You likely have prediabetes. Statistically, 1/3 of you out there do, but if you have any of those type of symptoms, you have a pretty good chance of that being you. You know, if you feel kind of like a little woozy if you don't eat, or a little nauseous, or if you get a little bit dizzy, or if you can't lose weight, all of those are things you should be concerned about, that you may be developing diabetes. And, you know, if you're overweight as well. Now, before this next break, I wanted to give you a chance to call and register for the workshop. You can call 837-7174 to register. This one's going to fill up quickly, and we do have limited seating. So go ahead and call and leave your name and number on the machine. And when my staff gets back in Monday, we will call you, give you locations, and book your seat. It's going to be August the 29th at 6:30 p.m. That's on a Wednesday. The number's 837-7174. And when we get back from this break, I'm going to give you the secrets that everybody should know about controlling and stabilizing blood sugar. So don't go away. We'll be right back. But that number was 837-7174. So stay tuned. Welcome back to Get Well Acadiana. Thank you so much for joining me on the show today. We're talking blood sugar. And in the previous segment, I was discussing that there are other things you need to know when it comes to dealing with a diagnosis like diabetes or prediabetes. And we were saying that diabetes is a disease of insulin, not of glucose or A1C. Insulin's job is to unlock the cell wall and put the glucose inside the cell to be used for energy. And in diabetes and prediabetes, insulin can't unlock the cell wall to put the sugar in. It's like the door is locked. And when the cells stop getting their glucose, they think they're starving. So they send signals to the body to eat more sugar and to crave more sugary foods, which compounds the problem. So if you're out there listening and you crave sugar, or you have these strong cravings for sweets, chances are you may already have prediabetes. And then what happens is all this extra sugar builds up in the blood, and that signals fat storage in the body. And your body will build fat cells to store some of this extra sugar in. And also, some of that sugar begins to spill over into the kidneys and into the urine, which we can pick up on urinalysis. And that's why we do urinalysis, to check for this. But all of this glucose spilling into the kidneys, what will happen is the patient will start to notice they urinate more frequently, and this causes the blood to get thick. So patients find themselves thirsty often. One of the things we see with pre-diabetics is they wake up in the morning and they're very thirsty, or they wake up from a nap and they're just, they're very thirsty. That's a sign pre-diabetes. Now, as the blood gets too thick, poor circulation begins to occur in the extremities. So the extremities get these non-healing wounds, and the feet can stay cold. And as you begin to get these diabetic neuropathies, which is burning and tingling in the feet and legs, then at some point the legs can need to be amputated if it gets bad enough. And then the thick blood also affects the tiny arteries in the eyes, so your veins begin to fail, and that can be the leading cause of, that can lead to blindness. That can be one of the causes of blindness. Now, since the cells use sugar or glucose as fuel, and they're not getting the fuel they need, these patients are tired often. Like they just don't have enough energy to get through the day. Their cellular processes don't work very well. The cells become more and more deprived of glucose, and the limbs begin to become really compromised. And at this point, it's a very late stage, and the patient can end up dying from what we call a comorbid disease. That means that the diabetes didn't kill you, but an infection did because you didn't have enough blood supply in your extremities, or pneumonia did, or some other disease that you got because you had diabetes and didn't address it properly. So diabetes doesn't get them, but the side effects or the comorbid diseases end up catching up with them. And all of this can happen to somebody that thinks they just have normal diabetes. So remember, most of these terrible side effects happen to people who were managing their blood sugar. So it's time for an entirely new approach. You may not have to go down this terrible pathway. We want you to know that insulin levels is one of the most important things that you can know, and leptin levels is another important thing that you need to know. And I tell you what else that we need to look at, and that is brain function. This is overlooked many times as well in the management of diabetes. Are you starting to become dementia? Are you starting to lose the functioning of your brain? You know, Alzheimer's is now being labeled as diabetes of the brain because of the close relationship between insulin levels, blood sugar levels, and brain function. Your brain runs almost purely off of sugar, off of glucose. So they're now calling Alzheimer's diabetes of the brain because it directly relates to how your brain processes sugar. Now, according to the latest literature, people with diabetes have a 2 times greater risk of developing Alzheimer's. But get this, if you're taking diabetes medicine like insulin, your risk increases to 4 times because insulin is toxic in high numbers in humans. And that was my point in the last segment. And that's why just increasing your insulin levels to force your blood sugar numbers down is not the best route whenever it comes to diabetes. And so we want to test your insulin levels, and our lab does that. We also want to test your leptin levels because leptin is insulin's boss. So we also check leptin. And we have several ways that we can control leptin through dietary factors and several others. But we have to begin to look at the right numbers if we're going to try to solve something as complicated as diabetes. And we do an in-house blood panel on diabetes where we check insulin, we check leptin, we check fructosamine, we check A1C and glucose. We also look at the building blocks of these hormones to make sure that your body's able to make them properly. We also check inflammatory factors and we check cellular functioning markers. All of this needs to be looked at. We check cortisol as part of the stress glands because cortisol can affect insulin production. We attempt to get the clearest picture possible, and not just of what you're diagnosed with, but why. Why the body's insulin has stopped being able to put the glucose inside the cell for use. And that's the secret here. If you can figure that out, why can't insulin get the sugar past the cell wall? Why is the lock broke? Now we're actually getting to answers that need to that are important to address some of these things. Now, we want to try to get as far upstream in these body conditions as possible. And then we ask ourselves this. Once we figure out the why, this is the next question that's the secret. Why are these cells doing what they're doing? And is there anything that we can do to make those cells work better? What can be done to get these cells to do what they're supposed to do? And the truth is, guys, when it comes to diabetes, there's lots of things that you can do to make the body process its sugar better. And honestly, it's not even that complicated. But it does take time. You have to be willing to invest the time it takes to sit down and figure this out with a patient. You can't do this in a 3-minute office visit. This takes time to sit down with each patient and go through each one of these steps in the body's processing its sugar correctly and figure out which step in the assembly line the body is breaking down. But there's tons of natural things you can do to make your body process its sugar better, and don't let anybody tell you there's not. Now, if you're interested in knowing more about this, I wanted to invite you to come to my free community workshop. It's open to the public. All of you are invited. It's going to be 1 hour out of your life to hear something new that just may change your whole future. And if you're interested, you can call my office at 837-7174 and leave your name and number on the machine. We're not at work at Saturday. And when my staff gets to work Monday, they will call you back and book your seat. So please be by your phone Monday morning, because when they get to work, they're going to be calling you. That number again was 837-7174. And stay tuned. Right after this break, I have more great information on diabetes. So we'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me. I hope you guys enjoyed this very important show today. And you know, Brandon, in the last segment, you were asking me about how fibromyalgia and diabetes are related. Mm-hmm. And I had mentioned something about energy deficit. And since we have a little bit of time left, I wanted to dive into that just a little bit more, because I kind of skimmed over that. And it's critically important that people understand this. We're finding that most patients are running on an energy deficit, and especially with diabetes, because remember, your cells use sugar for fuel, and if they don't get the fuel, they can't make energy. And when I say energy out there, guys, I don't mean it like this weird kind of metaphorical, hippie kind of energy thing. Your body makes an energy packet called ATP. That stands for adenosine triphosphate. ATP is to your cells what gasoline is to your car. ATP is what your cells use to make energy. And what we're finding is not only in patients with diabetes, but they typically have several other comorbid things going on as well. And all of this has caused their body to burn through its ATP, or burn through its fuel faster than its body can make it. So they're running on this energy deficit. And that's actually what's happening. And most of these patients, if you ask them, do you ever feel like your body is burning more energy than it's making? They go, that's exactly how I feel. And that's because that's exactly what's happening. And so we have to address this energy deficit, because if your body is running on this energy deficit, I don't care what problem you have, I don't care what disease you've been diagnosed with, and I don't care what treatments you're doing, your body cannot move forward and heal if it does not have the energy to move forward and heal. You could be at the best clinic in the country. You could be at the Mayo Clinic. You could be in California, where all these stars go to get better. You could be at the best clinic in the country. And if your body does not have the energy to heal its cellular processes, it cannot do so. I don't care what your chronic diagnosis is. You could have the worst disease imaginable, or you could have the mildest disease imaginable. And this energy deficit problem is key to understanding. And that's why the first thing that we do whenever a patient comes in as part of our wellness program and our functional medicine program is we have to look at their body's energy deficit. We do this with our weight loss clients. We do this with our patients. No matter what their diagnosis is, we have to address that before we can move forward. So we always do that first and make sure that their body is able to make enough fuel to move their health from one level of health up to a higher state of health. Because without that energy, it's not going to happen. I don't care what else that you do. So I hope that I've been able to convey to you guys that diabetes is not something to take lightly, and that diabetes is a disease of insulin, not of A1C. Insulin's job is to put the sugar inside the cell for energy, and in diabetes, insulin can no longer do that. Insulin can't get the sugar inside the cell to make energy. Now, most diabetes drugs simply whip your pancreas to make more insulin. Now, if I flood your body with enough insulin, that's like ripping the door off and forcing sugar inside the cell. That's what would be like if we're talking about a car here. I like cars, so I use car analogies. If you're trying to pump gasoline in your car and you have one of those locking gas caps, That's kind of how insulin works. It has to be able to unlock that to put the fuel inside the cell. Now, in diabetes, it's like the lock is broke. The key's not working. And with this medicine, it's basically like just ripping the gas cap off, the cover, and the whole thing. Just rip the whole thing off and just pour gas in there. It will bring your blood sugar down, but man, it's just insulin in high numbers are toxic. So I want you guys to know that diabetes is no longer a life sentence. And at the workshop, I'm going to show you how you can get yourself on that pathway to where later in life you can enjoy yourself and do whatever you want for as long as absolutely possible. Just like Harriet Thompson we talked about in the first segment. I'm going to show you the things you can do to avoid all of these pitfalls, the amputations, the blindness, the kidney dialysis, and dementia, so that you can be that older person we talked about that's having the time of their life and enjoying their grandkids and gardening and golfing, not the older person that's in the nursing facility or worse. The workshop is called 4 Secrets to Beating Diabetes. It's going to be August the 29th at 6:30 p.m., right in Broussard at the Hampton Inn Conference Room. And the number to call is 837-7174. That's 837-7174. All you have to do is call real quick, leave your name and number on the machine, and when my staff gets to work Monday, they'll call to book your seat. So I want you guys to know that I really appreciate all of you out there in the audience that listens to this show. It means so much to me when you guys are willing to take time out of your day to hear ways that you can improve your health so that you can have a longer, happier existence, because that's my whole purpose. I firmly believe I was put on this planet, other than to be a great dad, I was put on this planet to try to help as many people as I possibly can find the pathway to achieving a healthier life. And that's my goal, to try to help as many people as possible live a better life and be able to do whatever they want as long as possible using totally natural solutions. And that's been my mission now for the last 2 decades. I'm going on my 20th year in practice to try to show people that you do not have to develop these chronic problems. Let's get you on the pathway where you can live a happier future. That number to call to the 4 Secrets to Beating Diabetes workshop is 837-7174. That's 837-7174. Thank you all for listening. I appreciate each and every one of you out there. Have a great weekend. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. This is the show where we discuss all matters of sickness and disease, where we talk about new advances in natural health care and functional medicine, and show you ways that you can change your future by improving your health without drugs or surgery. I'm here with my good friend, Brandon Como. Brandon, how's it going today?
Doing well, Doc.
Man, last week we had a very important discussion on diabetes and some natural solutions to those people that are suffering with diabetes. And we had a tremendous amount of questions and comments on that show. And one of the big things that I wanted to get across last week on diabetes is that it's no longer a life sentence. And so Brandon and I wanted to answer a few of those questions on the air today before we get started. And guys, remember, we talked about this last week. 1/3 of Americans are now pre-diabetic. Half of all Americans over 65 are pre-diabetic. So this show is for everyone. These topics are something that could really make a huge difference in how healthy you're going to be down the road. So what we did was we took some of the top questions, and there was several people had the same questions, and so we kind of grouped those together, and we wanted to answer a few questions before we get started today. So Brandon, what's the first question you have for me?
All right, so the first question for today is, why are you the only doctor talking about doing more than just managing diabetes? I don't really hear a lot of other doctors talking about anything but managing my blood sugar.
Well, that's true. And I'm not the only one. There are some real smart, natural-based doctors out there talking about this. So, I'm not the only doctor talking about this, but it does get pretty lonely here in natural healthcare land sometimes, it is definitely different than, traditional established-based where they're at on that. And there's several reasons why traditional healthcare focuses so much on management and not so much on getting over these things. And that one question could be a whole hour show, but I'll try to give you a few. I think the number one reason that it's about management is because it takes time with patients to figure out why they've developed diabetes and a pathway for them to getting better. Brandon, I spend hours with these patients getting to the bottom of these issues. We go in their history all the way back sometimes to birth. That's how far back in their history that we take them. And for sure, we go all the way back to their teenage years on sort of what they've been exposed to and their history all the way back. So, I spend a lot of time with these patients. It takes time to figure out why the body has stopped processing its insulin correctly and, to figure all of this out. And time is something that just the way the healthcare system is today, there's not a lot of time to go around. But I think the other issue about why it's all about management of blood sugar and not about getting over diabetes is because, and this is an important one, but the general thinking in traditional healthcare, and I've actually had traditional doctors say this to me, is that, well, patients aren't going to do what it takes to solve this anyway. Patients won't change. They're not going to do it anyway. So people would rather just pop a pill and get on with their life. Here's the thing. That might be true for some patients, maybe even the majority of patients. Maybe 60 to 70% feel that way. Many folks, unfortunately, just won't spend the time or make the changes that it takes to solve their health problems. And fortunately, it's just not that important to them. But Brandon, that's not everyone. That's not all of them. There's another 30 or 40% of patients out there that are looking for real answers and want to get healthy. They just don't know exactly what to do. There's a portion of patients out there that have diabetes that are unsatisfied with what they're doing. So traditional healthcare is focused on that 60 or 70% that just want to pop a pill. And that's left that 30 or 40% searching for answers that they can't get anybody to really address or explain what they have going on in a comprehensive way. And that's the group that I want to address. Those folks that want to know, why did my body do this? Why is this happening inside my body? What can I do to fix it so I don't end up with the kidney dialysis and the amputated legs and the blindness that comes along with diabetes that has not gotten under control in the proper way? There are people out there that want to learn the proper pathway to getting better. And so I always tell people, my program's not for everyone. It's for those people who really are ready to address their health in a comprehensive, common sense strategy to get over the health issues they have. So the bottom line is, the reason that it's all about management is it takes time and it takes less time and it satisfies most patients, but there are solutions out there for you 30 or 40% of you that want to get better, but it takes time, expertise, and dedication. And that's what I try to offer the great people here in South Louisiana. And, the workshop that I'm going to go through next week is going to go into a lot of that, on what we have to do to really get to the underlying issues. And then we had a second question, Brandon. What was the second question we got?
Well, the second question was, how much does diet figure into your program, and why don't you talk more about that?
That's a great question. And I do talk some about diet, but the reason that I don't talk about it so much is because in patients' mind, when they think fix my diabetes or work on solving my diabetes, they think it's 100% diet and they have to eat like a rabbit and I'm going to feed them kale all day. It's not, it is a factor, but it's not the only factor. You do not have to eat like a rabbit. You don't have to deny yourselves the food that you love to get over diabetes. Diabetes is a disease of insulin malfunction, not of blood sugar. But there are several reasons why the body begins to malfunction and stop using its insulin correctly. And so blood sugar is the symptom, not the underlying issue. And we want to get as far upstream as possible in the body's disorders. And, diet is a factor, but it's not everything. And when it comes to diet, you don't have to eat kale and spinach all day in order to get over your diabetes. And in fact, quite the opposite. Most of my diabetic patients, I actually have to have them eat more and not less. And we have an entire system whenever it comes to nutrition and diet for the diabetic patient. And the thing that makes our nutritional part of our diabetes program so different is it starts with testing. I'm now able to test every patient to see what foods their body agrees with and what foods it does not agree with. So we test the patient for food intolerances. We test for almost 100 different foods and your body's reaction to those specific foods so that we know which foods you should be avoiding. We don't like guessing in my program. We use data, scientific data, to help our patients get better. But diabetes is a terrible disorder that will destroy your body from the inside if you let it. And so when it comes to nutrition, we want to know exactly what foods your body reacts negatively to. And then we create a system to where we eliminate just those foods for 8 to 12 weeks. And then we try to slowly reintroduce them. And maybe your body won't be so intolerant to them anymore. And so that's the way diet figures into our program. Diabetes is the number one cause of blindness. It's the number one cause of kidney dialysis. 1/3 of diabetics end up on kidney dialysis. It's the number one reason for patients having their legs amputated. You have a 4 times greater risk of getting dementia or losing your memory. Over half the diabetics develop neuropathy, which is numbness or tingling or lack of sensation in the lower extremities. Many get non-healing wounds on the bottom of their feet that can lead to these amputations. And here's the thing. All of these terrible complications happen to people who are, quote unquote, controlling their diabetes. So if we have to alter your diet a little bit, but still give you great food that your body agrees with, that's really high in healthy fats and filling foods, that's something that, is definitely a good trade-off. And you're going to learn on today's show. I'm going to go through all of the details of diabetes and what you should know and what you should pay attention to in the condition of diabetes, and just how terrible that is for the inside of your body. So right after this break, we're going to discuss what diabetes means in the body and what you can do to prevent it if you don't already have it. So if you know somebody with diabetes, text them or call them right now and tell them to tune into this show. And I'm going to be hosting a free community workshop called 4 Secrets to Beating Diabetes. And at that workshop, I'm going to give you all the tools you need to make sure that you're putting yourself on the pathway to prevent those terrible side effects like the amputations and the dialysis and the blindness. You'll leave there with the best understanding of what's actually happening inside your body at a cellular level. The workshop's going to be Wednesday night, August the 29th, at the Hampton Inn Conference Room right there in Broussard. You can call and register. You can call my office right now at 837-7174. That's 837-7174. And obviously, we're not at the office, so leave your name and number on the machine. You'll get a machine. Just leave your name and number. Say, I want to register for the diabetes workshop. And on Monday, my staff will call you right back as soon as they get to work. Now, Dr. Fontenot in New Iberia is going to be hosting the very same workshop at our other location. And their number is 367-2567. And when we get back in the office Monday, we'll call you. Make sure you tell other people out there about this workshop that have diabetes. We don't want people to continue down this terrible pathway of diabetes that we talked about. Now, I'm going to explain much more detail about what happens inside your body at a cellular level in the diabetic patient when we get back from this break. And that number again was 837-7174. We'll be right back. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. The topic today is blood sugar, diabetes, how you can control it, what else you should be concerned about, and how it affects your health. And in the first segment, we were discussing how just managing your blood sugar numbers and doing nothing else is not the road to a long, healthy life. In fact, it's likely the road to worse problems down the road, because many of the terrible complications that happen with diabetes can happen in a patient that's controlling their blood sugar numbers. You know, we have the amputations and the blindness and the kidney dialysis that we talked about. All of those terrible complications are something that you want to try to avoid at all costs. But the general public feels like as long as they're managing their blood sugar numbers, as long as their blood sugar numbers are kept in this little box that they consider normal, then they're healthy and everything is fine. And that's not true. That is not healthy, and it is definitely not fine. But typically what happens is someone will go for a checkup, or they'll go to some doctor visit of some kind, and they'll have their glucose and A1C tested, and they'll be told, well, your blood sugar numbers are a little high. I'm going to give you some medicine to bring that down. And then on their next visit, they're told, yeah, blood sugar numbers look great. You're healthy. Just keep on taking your medicine. Look, we fixed it, kind of thing. Some patients go on for years with this idea that as long as they're managing their blood glucose and A1C numbers, that's all they need to do. Guys, listen, America now takes 50% of all the pharmaceutical drugs on planet Earth, yet we are only 4% of the world's population. We spend more on health care than anybody else in the world, and China and Cambodia have a longer life expectancy than we do in the United States of America. So just managing your blood sugar is not the whole story. And keep in mind, like I said, 1/3 of you out there listening already have prediabetes and you don't know it. And actually in South Louisiana, it's even higher than that. 50% of Americans over 65 have prediabetes. And what prediabetes means is that if you don't do something now to turn this around, you're going to end up with full-blown diabetes and all of the side effects that come with it if you don't take action. Prediabetes is way easier to address than full-blown diabetes. So if you've been told you have prediabetes, you're going to want to make this workshop called 4 Secrets to Beating Diabetes. I'm going to show you how to avoid all of this stuff we're talking about. And with prediabetes, it's not even that hard. It's a fairly simple thing to do. You just have to know what to do. But 70% of the people out there with diabetes develop this neuropathy, which is a terrible thing. This is, tingling and burning in the feet and where they can't feel their feet. And then, unfortunately, the next thing is they can get falls and because they can't feel their feet, or they may have a wound or a lesion on the bottom of their feet that they don't even feel is there because they can't feel sensation in the bottoms of their feet. And it can also lead to damaging the kidneys. And so we do a complete kidney evaluation on every diabetic patient that we see. Brandon, I had a patient with diabetes in just yesterday, and she's had diabetes now for, I don't know, I think she said 6 or 7 years.
Yeah.
Her doctor had never done a urinalysis.
Oh, really?
Never once.
Oh, man.
That's the first thing we did because we want to look at the kidneys. You got to check the kidney function because one of the things about diabetes is it damages the kidneys. Why you would not want to know that? Man, that's one of the most important things that we did. And guess what? We found tons of issues there. So we were able to head off a really serious kidney problems in this patient because we just looked. We checked that we checked the numbers. And diabetes is also one of the things that can cause blindness. And so I want you all to understand that diabetes is a serious thing. It's not something to take lightly. And so many patients that I talk to go, Doc, I just have the normal diabetes. I mean, I'm healthy. My blood sugar's been pretty good. I'm taking my medicine. Doc said I was fine, Here's the thing. Here's the truth about this, and I'm going to talk more about this at the workshop, but the truth about diabetes is it is a disease of insulin, not of blood sugar. So the first thing we want to know is what your insulin levels are, not just what your blood sugar numbers are. Insulin controls blood sugar. Why we're not testing for insulin levels in the diabetic patient, I'll never figure that out either. Many of you out there that have diabetes have never had your insulin levels tested. You've had your glucose and A1C levels tested, but have you ever had your insulin levels tested? Why would you not want to know that? Diabetes is a disease of insulin. And here's why that's so important. Insulin's job is to take the sugar from your blood. So you eat and you get sugar in your blood from that food. And insulin's job is to take that sugar and put it inside the cell to be used for fuel. So your cells run off of glucose. They run off of sugar. That's what controls your cellular energy. That's what your cells burn for fuel. And guess what? Your brain is almost 100% ran off of glucose. So insulin grabs that glucose molecule and it opens the cell wall. So pretend there's a little door in the cell wall, and insulin has the key and it unlocks the door and puts the sugar inside the cell to be used for fuel, and then shuts the door back and locks it. And that way the sugar's inside the cell so the cell can process energy and do what a cell's designed to do. Now in diabetes, that process has stopped working. Insulin can't get the sugar inside the cell to be used for fuel. It's like the lock is broke or he lost his key. Now the cells think that they're starving, and actually they are starving. So you end up with craving more and more sugar because the cells aren't getting it, even though it's loaded in your blood. Now, many of these medications for diabetes, like these metformin type medications, they whip your pancreas to produce even more insulin, which sort of just forces the sugar inside the cell regardless of what else happens. And the problem with that is that if your blood sugar numbers look good, but your insulin is in really high levels, that can be toxic to the human body. So if your blood sugar numbers look good, but your insulin is 5 or 6 or 7 times normal, that's not good. Insulin is a hormone that's secreted by the beta cells in the pancreas. And in addition to regulating your glucose in your blood, insulin also acts as a general signal to all cells to start drawing nutrients from the blood. So without insulin working correctly, the cells will eventually starve because they're unable to transport other nutrients into the cells as well. Insulin also stimulates the cells in the liver to restore glycogen, which turns into excess fat. So the body stops breaking down fat in the tissues for energy if insulin is off, if the insulin levels aren't there. So fatty acids and proteins in the blood are what get used for energy, and in the insulin imbalance, that stops happening as well. So if your blood sugar numbers look good, but your insulin is 5 or 6 times normal, that's damaging to the body, or at least it can be. But we don't know that because we don't test for insulin. All we're testing is glucose and A1C. These are all concepts that I'm going to get into at my workshop called 4 Secrets to Beating Diabetes. I'm going to show you the relationship between insulin and A1C and glucose. And we'll also talk about leptin. You know, leptin is the hormone that controls insulin. And insulin is the hormone that controls A1C. So leptin is insulin's boss, and insulin is glucose's boss, or A1C's boss. So you want to get as far upstream as possible in these disorders to get to the underlying reasons why this has happened in the first place. And that's one of the big secrets that I'm going to be talking about at my workshop on August the 29th. It's free to the public. Everyone's welcome to attend. And I wanted to invite all of you out there that have diabetes or pre-diabetes to come hear about these new technologies. Now, even if you don't know that you have diabetes, but let's just say you feel ran down or tired all the time, or maybe if you don't eat, you get a little dizzy or kind of woozy, or maybe you're having difficulty losing weight or you're low energy, you very well may have pre-diabetes. And these strategies will help you as well. Statistically, 1/3 of you out there listening do have prediabetes. So there's a good chance that if you have any of those symptoms, you may have prediabetes. And we'll be discussing all that at the workshop on next Wednesday. And so before this next break, I wanted to give you a chance to call and register for the workshop. You can call 837-7174 to register. Just leave your name and number on the machine. And when my staff gets back to the office on Monday, they'll give you a call and give you locations and all that. It's going to be the 29th, which is Wednesday night. The number's 837-7174. That's 837-7174. Now, in New Iberia, if you're closer to there, Dr. Fontenot's given the exact same workshop. His number is 367-2567. And when we get back from this next break, I wanted to give you one of the secrets that everyone should know about blood sugar. So don't go away. We'll be right back. And that number was 837-7174. Stay tuned. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me on the show today. And we're talking blood sugar today. The previous segment, we were discussing that there are other things that you need to know when it comes to dealing with a diagnosis like diabetes or prediabetes. And we're saying that diabetes is a disease of insulin, not of glucose and A1C. And Brandon, we were having an interesting conversation during the break. You know, the break's always better than the show. So what you were asking me something about it.
Well, yeah, and there's someone that I know that kind of doesn't fit the mold of, you know, someone having diabetes in the sense of appearance. You know, this is someone that is a very skinny man. You know, he's not an overweight person. It's really just happened to him over the last few years, and his diabetes have gotten incredibly worse to where it has really affected his eyesight to the point where he doesn't even drive anymore. Okay. And so it's really amazing when I see him. He doesn't look like, you know, he's not struggling with his weight, but man, you know, I see him before meals. He has to make sure that he's putting that insulin in every time. Yeah. And it's been getting significantly worse. And so, but it's like I said, it's just, he doesn't look like someone that would be struggling with diabetes on the outside, but on the inside, he definitely is.
Yeah, and first of all, I'm sorry to hear that, and you know, I'm glad that you brought that up because it's sort of this stereotypical, you know, what the person with diabetes should look like, right. And that's not true. Mm-hmm. Someone can be very thin and have what we call visceral fat or organ fat, meaning they may have fat around their heart and around their liver, especially fatty liver. That's one of the main things that we work on in diabetes. Is it, listen, if you're out there and your doctor told you you have a quote-unquote fatty liver, that is an issue that we address 100% in this program. And so, yeah, so it's you don't have to be overweight to have your insulin not processing its glucose correctly. So, yeah, it is this kind of big misunderstanding that, well, I'm not overweight, so I'm healthy.
Right.
Perfect example.
Well, because a lot of people associate where if they're borderline, if they're able to drop a few pounds, that they can get right back on the right side of the diabetes, and then if they put on some more weight, then it contributes to it. How much does weight gain contribute to? I know there's different kinds of diabetes. I know there's two different types, and there's different ways people can get it. But how much does weight gain have to do with diabetes?
So some people quite a bit, and other patients not so much.
Right.
It really kind of depends on how their own body processes and what stage they're at in this terrible disease called diabetes. So, you know, every case is just a little bit different. Yeah. But what happens in probably the majority of patients is their body goes through this downward cycle of they get diabetes, so their cells are starving, so they crave sugar, so they eat more sweets, so they gain more weight, and that those fat cells produce more, you know, insulin-based problems, and then they get this downward spiral of weight gain, worse diabetes, weight gain, worse diabetes. Now that doesn't always happen. Kind of like the example that you told us about. Yeah. You know, you don't. It's if you don't have to be overweight to have your body not processing its insulin correctly. But when the cells stop getting their glucose, they think they're starving. So they send signals to the body to eat more sugar, and that creates this downward spiral. And then what happens is that all this extra glucose builds up in the blood, and then they begins to spill over into their kidneys and into their urine, and we can pick that up on urinalysis. That's the case I was telling y'all in the last segment of we did a urinalysis on a patient that hadn't had a urine check in 6 years of having diabetes. And sure enough, we found this going on her urinalysis. So, just a 10-minute urinalysis, we were able to determine something there that hadn't been looked at. But what happens then, all this glucose begins to spill over into the kidneys, and you'll notice that makes you urinate more frequently, and that causes the blood to get thick. And then that blood getting thick causes this poor circulation in the extremities, so we get the wounds that won't heal. You start to get the diabetic neuropathies. And then the blood, as it gets thicker, it can start to affect the tiny arteries in the eyes, and that's what you were talking about, starting to lose their vision. They can't even drive anymore. Yeah. That's where this stuff's headed, guys. And so we have to address this. You don't have to go down that pathway if you just take a little effort to address your health problems. Now, since the cells use sugar for fuel, these patients find themselves tired often, and their cellular processes don't work very well. What I mean by that is this. When I say cellular processes aren't working very well, cells are designed to do things. A muscle cell contracts, a brain cell transmits, a stomach cell makes acid, a skin cell protects. So think about that. All of your cells are designed to perform part of you being able to live and walk around and be normal. And you're basically a collection of different cells. And so all of your cells can't work if they don't have the energy to work correctly. And in diabetes, they don't have the means to make that energy and do whatever process they were designed to do. Now, here's the other cool thing to think about. Your cells change every so often. You have a new skin cells every 15 days. You have, new liver cells every 7 to 10 years. You have, new heart cells every so often. All of your cells of your body literally change themselves out, kind of like you change your clothes every day. The only part of your body that retains itself is your brain and your nervous system. So we are essentially our brain and nervous system, and the rest of our cells just change themselves out. So then why, when those new cells are produced and they have fresh DNA and they're brand new cells, why are they still malfunctioning? Why hasn't those new cells started to do what they're genetically programmed to do? Think about that. There has to be something causing that. And that's where functional medicine and wellness care comes in. Why are the cells not doing what they're supposed to do? Now, the bad part about this end-stage diabetes is if this thing gets bad enough, the patient will end up getting what we call a comorbid disease, which means they get something like an infection from a non-healing wound that ends up, causing them to die, or they get pneumonia, or they get some sort of a comorbid condition. The diabetes doesn't get them, but something else they got because of the diabetes ends up ending their life. And remember, most of these terrible side effects like this happen to people who were doing their best to manage their diabetes. So I think it's time for an entirely new approach. You may not have to go down this terrible pathway. And we want to know what your insulin levels are. We want to know what your leptin levels are. We also want to take a look at brain function. That's something that's overlooked many times as well. Alzheimer's is now being labeled diabetes of the brain because of the very close relationship between insulin levels, blood sugar levels, and brain function. So they're now calling Alzheimer's diabetes of the brain because it directly relates to how your brain processes sugar. And like I said in the last segment, your brain runs almost 100% off of glucose. And so if you want to fuel your brain correctly, if you're tired of the foggy brain and the fatigue and the dementia and all that, getting this stuff under control, getting your fuel inside the cell is essential. Now, the other thing that we want to think about is that we want to test insulin levels in our lab, and our lab does that. So We have a special lab. Not all labs can even test for insulin. That's how rarely this is looked at. Some labs don't even have the ability to test for insulin, and ours does. We also want to test your leptin levels. Leptin is insulin's boss, and we need to check that. We want to check your dietary factors. We want to check your food intolerances like we talked about earlier. And our in-house blood panel tests all that: A1C, glucose, fructosamine, leptin, insulin levels. We check the building blocks of the hormones. We look at inflammatory factors. We check your cellular functioning markers as well. We look at how well the cell walls are functioning. We test the cortisol levels for the stress glands. We attempt to get the clearest picture possible of not just what you're diagnosed with, but the why you're diagnosed with it. Why has the body's insulin stopped being able to put the glucose inside the cell for use? And we always want to try to get as far upstream as possible, like I mentioned. And then we ask ourselves this very important question. And listen close here. We ask this: is there anything I can do to make that part of the body work better naturally? What can I do to make those cells do what they're supposed to do? And the truth is, guys, in diabetes, the answer is lots of things. There's lots of things you can do to try to get your cells working better. There's lots of things you can do to make your body process its leptin and insulin and blood sugar better. And honestly, it's not even that complicated, but it takes time. You have to be willing to sit down and invest the time it takes to figure all of this out, why the body's not processing all this correctly. So if you're interested in knowing more about this, I wanted to invite you to come to my free community workshop called 4 Secrets to Beating Diabetes. It's open to the public. All of you are invited. It'll be 1 hour out of your life to hear something that could just change your whole future. If you're interested, you can call my office at 837-7174. Leave your name and number on the machine. We'll call to book you Monday. The number's 837-7174. We do have limited seating. More great information on diabetes right after this break, so stay tuned. Welcome back to Get Well Acadiana with Dr. Kevin. Thank you so much for joining me. I hope you guys have enjoyed this very important show today, and I hope that I've been able to convey to you that diabetes is not something to take lightly, and that diabetes is a disease of insulin. And insulin's job is to put the sugar inside the cell for energy. And in diabetes, insulin can no longer do that. Insulin can't get the sugar inside the cell for energy, so no energy can be made. And our body must have a never-ending supply of energy in order to work correctly. And that's not happening. And if you can't get the fuel in the cell, these things will continue to increase. And, that's kind of the road that you're headed down. Now, most of these diabetes drugs whip your pancreas to make more insulin, and that will bring your blood sugar numbers down. If I flood your body with enough insulin, it will bring your numbers down. But insulin in very high numbers can be toxic to the human body. And we don't ever know that because we don't test for it. But diabetes does not have to be a life sentence. And at the workshop, I'm going to show you how you can get yourself on a pathway to where later in life you can enjoy and do whatever you want and enjoy your life as long as possible. I'm going to show you the things you can do to avoid all of these pitfalls, the amputations, the blindness, the dialysis, and the dementia, so that you can be that older person that's having the time of their life and enjoying the grandkids and gardening or golfing or whatever it is, and not the older person that's in a nursing facility or worse, even no longer with us. The workshop is called 4 Secrets to Beating Diabetes. It's going to be August the 29th at 6:30 p.m. right in Broussard at the Hampton Inn Conference Room. The number's 837-7174. That's 837-7174. And I want you guys to know, my only purpose for doing this is because I want to try to help you. My purpose is to try to help as many people as possible reach a higher level of health without drugs or surgery. I feel I was put on this planet, other than to be a great dad, to try to help as many people as possible live a longer, healthier life. And I've now been on a 20-year quest to do that. For the last 2 decades, I've been studying and researching and learning from some of the experts all over the world in ways to get sick people well using natural methods. So I hope that you'll come to the workshop. The number's 837-7174, and Dr. Fontenot's number is 367-2567 in New Iberia. They are the exact same workshop, so if you're closer to New Iberia, you can give them a call and go to that one there. My goal is just to try to help you guys, and I hope that I've been able to. That's been my mission, like I said, for the last 2 decades. So thank you all for joining me. Thank you for listening. That number was 837-7174. Have a great weekend.